I'd like to welcome you to this session. It is Season 4, Episode 10 of Gateway Center of Excellence in Rural Health's virtual lecture series. Today's date is May 7th, 2024, and the topic of the lecture is a snapshot of early settlement experiences. My name is Wayne Caldwell. I'm a professor emeritus at the University of Guelph in Rural Planning and Development and honorary chair of Rural Healthy Sustainable Communities at Gateway. The Gateway Center for Excellence in Rural Health is a not-for-profit organization based in Huron County with the mission to improve the health and well-being of rural residents through research, education, and communication. To our knowledge, Gateway is the only rural health research center in Canada governed by community-based volunteers not attached as a research arm of a larger academic institution. The lecture is part of Knowledge Translation Project to promote and mobilize understanding of health in rural communities. Before we begin, I would like to start by acknowledging the land. The Gateway office resides in Goderich on the traditional territory of the Anishinaabe and Neutral people. Under the dish of one spoon wampum, these groups agreed to care for the land and its resources by the Great Lakes in peace. We would like to acknowledge the history of the traditional territory of the land now known as rural Southern Ontario and honor the long-standing relationship of the Indigenous peoples across the region. Gateway Center of Excellence in Rural Health recognizes the inequities connected to colonization, which can impact health outcomes, and are committed to working towards creating a just, inclusive, and vibrant community for all. Gateway has been offering these virtual lectures for several years now. Previous sessions are recorded and available on the Gateway website, and I encourage you to have a look at that. To thank those that are ongoing attendees, Gateway offers a certificate at the end of each semester to those with perfect attendance to recognize your commitment to and involvement with this educational series. Throughout today's lecture, we encourage participants to ask questions, and the panelist and lecturer will attempt to answer those. Add your questions to the chat box at the bottom, and then we'll address those as time permits towards the end. A brief disclaimer, the views expressed in this lecture may not necessarily reflect Gateway's views or opinions, but Gateway believes in providing a platform for a range of perspectives and thoughtful discussion. And now, an introduction to today's topic. I've spent much of my career thinking about what makes a healthy, vibrant rural community. I think rural communities are critical to the nation, and for many of us, we live and work within rural communities. And what is it that we can do to make things better in those rural communities? For me, it's often about balancing the economic, the environmental, and the social. We think of that in the context of sustainability, but we have seen many changes, significant changes happening in rural communities. For one thing, our population is aging. We have challenges that creates, and connected to that, of course, many rural communities, or some rural communities, at least across the country, are experiencing declining population. These things, going on with other factors in the economy, are contributing to issues of labor shortages from a healthcare perspective, labor shortages from an industry perspective, labor shortages from an agriculture perspective, and on it goes. In response to these declines and shortages, many rural communities have embraced the concept of and importance of immigration and being a welcoming community. And we'll hear about both of those terms in a little bit more detail, and providing quality services. And again, we'll hear about that as well. This, of course, brings me to the specific focus of today. What are the experiences, needs, and challenges of refugees? And in particular, we'll hear about the challenges that Syrian refugees have experienced in southwestern Ontario through the work and research of Rana Telfah. What is their role? What are the potentials that may occur? And how, again, can we make sure that services are provided to make folks feel welcome within these communities? So to begin with, our keynote speaker will be Dr. Rana Telfah. She'll lead us in her presentation. Rana graduated with a PhD in Rural Studies from the University of Guelph. Her research is titled The Early Settlement Experiences of Syrian Families in Southwestern Ontario. We will hear about that research as just mentioned. Rana also holds a Master of Science in Rural Planning and Development from the University of Guelph. Rana moved with her family to Canada in 2012 after previously working in Jordan in non-governmental organizations. Following Rana's presentation, and I will say we've had a technical glitch, so I'm going to be checking in a moment to make sure Rana's actually with us. But assuming that Rana is able to go first, following her presentation, we will hear from two panelists. The first being Mark Nonkes, and Mark is the manager of the Huron County Labor Immigration Partnership. And prior to his current role, he has worked with newspapers in southwestern Ontario and in international development and human rights in Kenya, Laos, and Namibia. One of these days, Mark will have a discussion about that. He holds an MA and an MLIS, and Mark will share some interesting survey results from work that's been conducted in Huron and Perth County. Following that, we'll hear from Dr. Ray Silvius. Ray is an associate professor in political science at the University of Winnipeg. He writes in the political economy of refugees, immigrants, migrants and refugees in Canada's economy and society, the organization of Canada's newcomer settlement sector, and international political economy. Ray will provide some insight into his current research and the concept and practice of welcoming communities in rural and remote communities. So let me just check, Rana, are you with us there?
Yes.
That's
can
excellent.
You hear me? Yes.
I can hear you fine.
Yeah, I can access through my iPhone. So,
okay.
So can you help me with the slides?
Isn't technology wonderful? Well, I just welcome Rana. Glad you were able to join us. We were just, for the audience, we were just back and forth a few moments before connecting and hoping that everything would work well. So we find alternatives to the technology. So I'm going to share the slide screen, Rana. You'll have those. I'm assuming you can see the slides as I go through them?
Yes.
Okay, great. So with that, I will mute myself and share the screen.
Sorry, I can't see the slides. Sorry.
Yeah, you should.
I'm not able to see. Yeah. Now, yeah.
Just 1 second here.
Yeah.
And you can see the first slide, Rana?
Yes.
Excellent. Okay, over to you.
Okay, thank you. Thank you, Professor Wynn. Good afternoon, everyone. Today, I look forward to sharing with you the findings of my research work about the early settlement experiences of Syrian families in southwestern Ontario. But first, I would like to thank Gateway and show my appreciation for them for the support of my research work. For this today presentation, I will start by introducing the Syrian conflict and the Canadian response to this conflict. I will look into the research framework, which includes the research objective, the social reproduction theory that is adopted in this research work, methods, and participants. And I will delve into part of my key findings of this research. Okay. Yes. The Syrian conflict began in 2011 with civil society demonstrations against the Assad regime, which dominated Syria for 30 years. And due to the conflict, Syrian families fled to neighboring countries, as it is shown in this map, to Lebanon, Turkey, Jordan, and Egypt. And following the years of the conflict, a small number of these Syrian families migrated to different parts of the world, including the United States, Europe, Australia, and Canada. And by 2019, Canada resettled some 54,000 Syrian refugees, and working with UNHCR, resettled refugees under the following programs: the Government Assisted Refugee GR program, the Privately Sponsored Refugee PSR program, and the Blended Visa Office Referral BVR program. And the province of Ontario welcomed the most significant number of Syrian families compared to other provinces. And many of these families were resettled in big cities, such as in Toronto, Ottawa, Windsor, and Waterloo region. Furthermore, southwestern Ontario received a portion of these Syrian families. This region, which includes census metropolitan areas, census agglomeration areas, and rural small towns. Rural small towns were crucial to Syrian refugees resettlement because they sponsor refugees through the private sponsorship. And the objective of this research is to explore Syrian families' early settlement experiences in their respective communities via different sponsorship types. This research looks or brings attention to the household level and the factors and analyzes the factors that change the social reproductive activities and the variances in the experiences between husband and wife during early settlement. Moreover, it explores Syrian families with regards to their employment, housing, employment, health, and education. Also, it examines how Syrian families developed relationships with the local residents, sponsors, and neighbors. Also, this research explains their experiences with learning the English language, the presence or absence of interpretation services, the local settlement services, the access to transportation, the access to Arabic schools for their children to learn the Arabic language, and the access to cultural food. This research particularly examines whether there are differences via different sponsorship type as well. And finally, it delves into Syrian families' perception of safety and stability in these communities, and whether they prefer to stay or leave their respective communities. So in this research, the social reproduction theory plays an essential role in understanding their early settlement experiences, and especially women, as this theory helps in clarifying the changes in gender roles and responsibilities at the household level. In addition, it explains the relationship of family members with the labor market, including the priority to join the labor market and the availability and the affordability of services and meeting the specific needs of these refugee households. And more importantly, the local context in which refugees settle plays an essential role in their integration process. And for this work, the field work was conducted between January and August 2020, where I did 38 in-depth semi-structured interviews with Syrian families under the following programs: privately sponsored GR programs and BVR refugee families. So before the COVID, I did face-to-face interviews, and then I switched to telephone interviews during the COVID-19. And the context was Southwestern Ontario, where I was able to access to 12 different size communities. And the majority of the participants were married couples, and each family had five children on average. And I will share parts of their experiences during early settlement, the key findings. Yeah, moving on. Yeah, so during early settlement, at the household level, Syrian families witnessed changes in gender roles and responsibilities. Syrian families are mainly maintain traditional gender roles and responsibilities. They adhere to patriarchal values and maintain separate public and private spheres. And in this research, most Syrian women who arrived to Canada came with their as dependents on male family members. They arrived with big families. The family size ranged from 2 to 10 members per household. In addition, they lacked the public experience and were underrepresented in social life. And this study revealed that most women had added responsibilities in their households, including the cooking, cleaning, laundry, and this work kept them occupied all day, which was a source of stress and depression for them. Moreover, they were the primary providers for caring for their new babies, as many had new babies during early settlement, in addition to the school-age children and the following up with their homework. Childbirth and childcare requires nurturing and continuous attention, which makes settling into a new context more exhausting and requires a longer time to settle down in their community. Furthermore, Syrian women reported a new lifestyle or a new life routine in which they were forced to leave their houses for dropping off their children at school, picking them up, and they were mainly the ones who communicated with the schools and followed up with the school teachers on various issues related to their children, and were responsible also for medical appointments. All of these new responsibilities emerged in the new context and previously did not exist back home. Therefore, during early settlement, learning English as a second language was quite challenging for Syrian women. So they were busy supporting their young children. Also, household work was among other barriers that prevented women from joining the labor market, as it was not a priority for them to find a job and join the labor market. Now I'll move to the Syrian families' experiences with housing, employment, health, building relations, learning the language, and safety in rural small towns and CEO communities. Next slide. During early settlement, the first demanding experiences faced by Syrian families were related to housing. So this study showed that the housing experiences of Syrian families varied according to sponsorship type. And when government-sponsored families move to rural small towns, they face various barriers in the housing market. And these challenges included finding a house that accommodated their family size, met their needs and expectations, and was maintained adequately. In addition, there were some families who shared that they were rejected by landlords because they have big families. And this quote of this GR woman who moved to a rural small town with her 6 children shows an example of the challenges that GR families face in rural small towns when trying to find a house and takes a longer time to settle down. However, the next slide, please. When privately sponsored and BVR families had moved to these communities, they moved into communities where their sponsors handled the searching a suitable house for rent for them. Also, in their cases, because they have also big families, sponsors had difficulty to find houses that accommodated their family size. So in this example, where the privately sponsored man shared that their sponsors were challenged to find a house to meet their specific needs, they bought the house and rented for them so as they can settle in their community. Moreover, high rental costs during early settlement, GR families in rural small towns suffered from high rental costs, and they moved between communities even seeking affordable housing rent, and which exacerbated their financial constraints during early settlement. However, the privately sponsored VVR families shared that were considered the affordable rent as a significant factor in their positive housing experiences. With the support of their sponsors, they moved into furnished houses, paid affordable rent or cheap rent. Furthermore, they shared that the rent hasn't changed since they moved into their communities. Therefore, they were happy to stay in these communities due to the affordability of the rent. All in all, these findings suggest that the housing market is challenging in these communities. However, the sponsorship type played an essential role in alleviating some of the challenges that refugee families face during early settlement. Moving to the employment experiences of Syrian men in these communities. So the study findings suggest that men, irrespective of their sponsorship type, they prioritized joining the labor market, as they had worked all of their lives and were not used to stay at home without work. And they arrived with the previous working experiences, such as in carpentry, welding, and construction. And the following quote shows where the woman shared her husband's experiences with the employment, that he needed to find a job before the government sponsorship ends, as they needed income. And where also she added that she's not used to working at all. During the interviews with the Syrian men, they emphasized the importance of having stable income to cover their living costs and maintain a satisfactory standard of living. However, this study also showed that Syrian men face barriers into labor market, where most men had difficulty finding a job because they didn't know how to communicate in English. Even if they have the required skills, employers did not hire them. There were a few cases where some privately sponsored families or men received the support of their sponsors in finding employment despite the lack of English skills. Moreover, in many cases, these men also shared that there are few employment opportunities that exist in their respective communities. So searching for and finding a job is a daunting process that takes a longer time than it's expected. Therefore, they had to travel to other communities for employment. Okay. But however, also the lack of transportation was an added barrier for the men. And having a car is a must in these communities. Mainly in this research, participants highlighted the importance and the need to access to public transportation in their communities. They needed to manage their daily and family needs, connect with the wider society, but they all shared the lack of transportation in their communities. Furthermore, few men who arrived here in Canada had health problems that necessitated ongoing medical care. And these health problems acted as a barrier, preventing them from seeking employment or engaging in a physically demanding labor work. Consequently, these men found themselves unable to support their families financially and were compelled to rely on government assistance programs for their livelihoods. All of these mentioned barriers might make it more difficult and time-consuming to settle down as expected by government policies. Syrian families were unprepared to become financially independent within 1 year as expected. And the experiences of these families with the access to health care services. As I mentioned, during early settlement, Syrian families arrived with various health conditions, including suffering from trauma, psychological disorders, heart issues. They needed urgent dental work, disabilities, and women arrived pregnant. Therefore, they needed immediate care and follow-up. All families in these communities readily have access to a family doctor. However, all of them shared that they faced language barriers and preferred access to Arabic-speaking doctors. With regards to interpretation in these communities, there is a limited interpretation services in these communities in terms of the availability and affordability. In these communities, the privately sponsored ones shared that their sponsors supported them with limited interpretation services as it was costly. However, the GER families did not receive these services. They shared that they faced difficulties in communicating with others. In some cases, they sought friends' help or depended on their young children for interpretation. In this study, also, women arrived pregnant or had new babies, and they addressed that their health needs were addressed with family doctors or midwives as well. There were few women here in rural small towns. They preferred the midwife services as they considered these services to be culturally appropriate and serve their specific needs during the initial stages of settlement. However, all Syrian families suffered from long waiting periods for specialist appointments or emergency rooms in a hospital, irrespective of their condition, whether they were urgent or not. So, the experiences of these families in building relations in their communities. All participants shared that the local people were respectful, welcoming, and helpful. And they felt a good atmosphere in these communities where they felt welcomed and were supported by the community. In addition, Syrian families highlighted or emphasized the importance of building relations with the local people. And the privately sponsored and BVR families' initial relations were with their sponsors, and they maintained unique, friendly, close ties with their sponsors. The sponsors also made pre-arrival arrangements to receive these families. And once they arrived, they introduced them to the community, familiarized them with the new environment, checked their daily needs. And also some of them were their neighbors as well. And which helped Syrian women building social circles with time in these communities and making friends with Canadian women. However, the GER families expressed or couldn't build relationships with local people due to the language barriers. Whom were all they shared that they had friendly and helpful neighbors. However, these families who moved to these communities were disadvantaged due to the lack of ethnic community. There is a small Arabic-speaking community. Some communities received 1 family, and others received up to 15 families. And during the interviews, Syrian families highlighted that it was essential for them to be surrounded by people from an ethnic group to visit, share experiences, help each other. Even furthermore, there were some families shared their feelings of unhappiness and even isolation, and the desire to leave their community due to the lack of people from their ethnic group. Moreover, they shared the lack of other services that they needed in their daily lives, such as the access to a worship place, access to Arabic schools to their children. They faced challenges in sending their children to schools outside their community. Also, they had to travel to different communities around their communities for shopping for their cultural food. In terms of the learning English as a second language, in this research, all Syrian families emphasized the importance of learning the language, and women even highlighted the importance of joining these classes. It's not only for learning the language, it's also to avoid loneliness and isolation, part of their socialization. However, women suffered from interrupted learning experiences due to household responsibilities, pregnancy, childbirth, and the unavailability of daycare spots where there is a long waiting period to find a spot for their children. And men prioritized joining the labor market. Moreover, these families who moved to these small communities had added barriers to ESL learning. The lack of ESL schools in these communities, some families were deprived of learning the language. Also, there were some men and women shared that the delivery mode was inefficient, where they included students from different levels in one class, which made their learning more difficult. Furthermore, they shared about that their low formal education, age, their displacement challenges also were barriers to learning the language and made this experience very challenging for them. And finally, these families shared that they moved to a safe and quiet communities. They felt accepted in their communities, and they highlighted the warmth and kindness of locals, and which did not make them feel like strangers in these communities. Finally, I would like to thank my committee, Professor Wayne Caldwell, Professor Belinda Leach, and Professor Ryan Gibson for supporting my work. And thank you, everyone.
Great. Thanks very much, Rana. I'm just imagining a round of applause happening out there virtually. And if you're feeling good vibes coming to you, I'm sure it's all about that.
Thank you.
Thanks very much again. Now we'll turn it over to Mark, and he will take us through his materials.
Thanks so much, Rana. I feel like you accurately capture what it's like to work, particularly with newcomers to Canada who are not fluent in English when they arrive. You've done a great job, and it certainly reflects the reality that we see in Huron and Perth counties. I lead the Huron County Immigration Partnership, which is funded by IRCC, the Immigration, Refugees and Citizenship Canada, and we work in the County of Huron in the Economic Development Department. Our goal is to create a more welcoming community for immigrants so that they feel a sense of belonging. And the way that we do that is we encourage people and organizations to work together. We host community events. And we also try to build the capacity of frontline workers who are providing services to immigrants and newcomers to Canada. There are 11,515 immigrants that were recorded by Statistics Canada in Huron and Perth. And we wanted to better understand their experiences of moving to our community. So we decided to do a survey. So let's go to the next slide. The goal of the survey was to better understand their experiences of living, working, and studying here. We wanted to better understand the challenges that they were facing. We wanted to identify the strengths that they were bringing and contributing to the community. We wanted to solicit their suggestions for improvements and integration in Huron and Perth, and we wanted that data to inform, prioritize, and improve future service delivery for ourselves and for our partners. And we work with about 25 different partners in Huron-Perth. So let's go to the next slide. So we took a look at what's out there, and the Immigration Partnership in Waterloo region has already been doing a survey of immigrants. So we used that as a blueprint, and we partnered with the University of Guelph's Community Engaged Scholarship Institute for their expertise in research and data analysis. And we created a 43-question survey with a group of experts who are frontline service providers. And that went for ethics. And then we started research recruitment in November 2020 23, and we had 195 responses that were immigrants in Huron and Perth. And so let's go to the next slide. What we learned was the people who filled out the survey was 105 people from Huron County, 90 from Perth. 65% of those who filled out the survey were newcomers. So people who have been in Canada 5 years or less, and they came from 49 different countries, but now live in our communities. Next slide. Almost an equal split of male and female. And then 81% of the folks who came spoke more than one language fluently. 71% of those immigrants and newcomers had completed college, university, or an advanced degree, and 90% felt they could speak, understand, read, and write in English very well, or fairly well. The bulk of the folks who had moved here were employed, either part-time or self-employed, and many were full-time. There were some unemployed, some students, homemakers, retired, and others. Similar to some of Rana's results, quite a number of people said that their international education and experience was not recognized. So this is putting the positive spin on it. 39% said, yes, my job in Canada is at the same level as my international experience and education, but that's quite a number who said no. And 46% said some of my international experience and education was recognized in Canada. Next slide. About a third of the people surveyed were volunteering already in the community, and they most frequently volunteered with an immigrant or newcomer organization or a religious organization. In terms of being a welcoming community, we asked questions that said, is this community that you live in welcoming? And 67% said it was very welcoming or welcoming to new immigrants. 60% would likely or very likely recommend community in Huron or Perth to other immigrants to settle, and 67% said they felt a strong sense of belonging in the community. But they were facing challenges, and many of the challenges were ones that Rana mentioned. So cost of living and money problems was by far the highest challenge. We asked people, what's the challenges you've experienced in the last year? And there was a list of about 25 different things they could choose from. And so cost of living, money problems came out strongly as the top issue, followed by finding a family doctor, finding affordable housing, transportation, finding work that matches my professional qualifications, finding a place to live, finding food that is my cultural preference, making friends, finding other health care such as a dentist, optometrist, etc., and learning English. And we did predict that household income might be an issue, so I wanted to make sure that we were illustrating that the most popular response was that people were saying they did not have enough household income, but if you put enough and more than enough, it was slightly ahead. Let's go to the next one. And then in terms of suggestions on the ways that we could improve the community so that other newcomers could reach their full potential, these were the top recommendations. Better programs for immigrants to find work or start a business. Availability of public transportation, have more affordable housing, have actions to increase welcoming and acceptance of immigrants, and educate employers on hiring, retaining, and promoting immigrants. So that's just a snapshot of the full report. It was 43 questions, and you're welcome to go to the website to download the report and read it for yourself.
That's great. Thanks very much, Mark. I think that leads really nicely into Ray's material. So over to you, Ray.
Great. Thanks everyone for having me here today. It's a real honor to be able to present here in this forum. And I'd just like to mention off the start that it was also a fantastic pleasure for me to be part of Dr. Telfah's PhD examination. And so really happy to have the opportunity to engage with your work again, Dr. Telfah.
Thank you.
So what am I here for? I do work on welcoming communities, and I do work on welcoming communities within Canada's smaller centres. So that's really the optic that I'm bringing to the discussion today. Next slide, please. To give you a bit of a sense of who I am, I'm at the University of Winnipeg in Winnipeg, Manitoba, but lest you think I am a big city kid, I grew up in what I would characterize as a smaller center here in Manitoba, that being Brandon. And a lot of my research is focused on communities that are grappling with how to become more welcoming to newcomers. And this is really a generational, if not multi-generational transition that communities are contemplating right now, or perhaps are in the middle of. And the vehicles through which I do this are a couple of networks that I'm a part of, one of which is called the Migration in Remote and Rural Areas Network, and the other is the Community Engaged Research on Immigration Network. And through those vehicles, I and some of my partners and collaborators try to contribute to this discussion in helpful ways. Next slide, please. So I'm not sure if we have a sort of icon function here in this talk. I was going to ask people in the audience if you have heard of this concept of welcoming communities in Canada prior to today. So not sure if I can gauge that from you all, but in your little corners right now, if you could raise your hand and maybe I will sense that in some way. I'm curious to know how much this concept resonates with people that might not do specifically immigration and newcomer related work. Because for those of you that are connected to newcomer spheres, you've probably heard it all the time, right? It's something that the Canadian federal government has been cultivating for probably a couple of decades now in a variety of forms. And this speaks to the idea that this is really a multi-generational initiative here to consider how smaller communities in Canada and larger communities in Canada can work better for newcomers. So it's a big paradigm that service providers work under. It's an objective that many people are enlisted to help achieve. And it's a series of concrete initiatives that come from the government and non-government spheres to make communities better for new arrivals. And it's something that the federal government has put a significant amount of funding and effort behind in the last couple of decades with various frameworks and action plans and initiatives. But the key is that they're supposed to be local in nature. They're place-based solutions is one of the things that we hear to sort of ensure that communities can cultivate the local expertise and the local contributions and the local knowledge to do this in a way that makes sense for them. So it's really a local initiative, a national initiative, and then all of those levels in between, right? And I won't go into too great a detail about this today, but there's all sorts of mechanisms for facilitating this at local, regional, provincial, and national levels. And that sort of networking aspect of welcoming communities is really important. And we'll talk about that in a little bit. And I think though central to the expectation of the federal government when they're doling out funds is it really kind of codifies and enshrines this expectation that local actors, so people living in a given community in their public and private lives, will participate in the settlement and integration of newcomers and lend their efforts towards creating a welcoming community. And so to me, when I think about this, the key takeaway is that the federal government in particular, but I think a lot of provincial and municipal governments as well, support this notion. But communities themselves are put in a position of doing a lot of the heavy lifting. And my entry point into a lot of these discussions is not only how do we make communities work better for newcomers, how do we support them and their new lives in Canadian communities, but how do we support the people that support the newcomers, right? And that might be a lot of you here today in your professional roles. So what is it that you need in your work lives to make your sphere of the community more welcoming to newcomers? And that's kind of what I'll talk about. Next slide, please. And just to give you a sense, I mean, imagine all of the things that you like about your community or all the things that you need to do on a daily basis. And those are things that are to be worked on to make communities more welcoming to everyone, but also to newcomers. And this slide here is just for illustrative purposes to show you some of the heavy lifting that communities have been entrusted with to make their communities more welcoming to newcomers. It's big things like public transportation systems. It's smaller things like just day-to-day interactions to make sure that they are hospitable, to make sure that newcomers don't experience racism and other forms of exclusion. It's systemic changes like rendering the healthcare system more sturdy and accessible to newcomers. So we're talking about welcoming communities, but we're talking about some pretty large scale and small scale transformations. Hard to encapsulate with a series of words, but you got to start somewhere. And these are kind of marching orders that communities have been given by the federal governments in order to make them more welcoming to newcomers. So how are we to accomplish that if they're to be accomplished? Next slide, please. Well, the framework for them, this is where we get into the really exciting stuff of immigration governance. So it might not be everybody's cup of tea, but as a political scientist, it's strangely maybe my cup of tea. But the federal government has set up mechanisms for this. So on the left, you see an example of a local immigration partnership in Manitoba, the Pembina Valley Local Immigration Partnership. And I don't need to talk about this too much here because Mark illustrated just a few moments ago as to what local immigration partnerships do, right? I'll also add to here the groups of provincial umbrella groups, like in Manitoba, the Manitoba Association of Newcomer Serving Organizations. And I highlight these two right off the hop because these groups are charged with kind of seeing things as my colleague Don Body likes to say, seeing them from a 10,000 foot perspective, right? So when you've got a settlement sector organization, a settlement service provider organization doing all the scrambling to offer direct services to newcomers to help with healthcare and school needs and employment needs and housing needs, that's busy day-to-day work, right? That kind of consumes all of your energies. These are two bodies that have been created and supported by the federal government to take the 10,000 foot view and to do the sort of connecting and facilitating and sinewy work to support not only settlement service providers, but the community at large do the work of welcoming, right? So this work is absolutely essential. It's often invisible and often not acknowledged. But if communities are to be welcoming places to newcomers, this work is absolutely crucial. For those of you that have tried to apply for funding for these sorts of services in your own organization, you'll probably know that it's hard to get money to do these sorts of indispensable things. So part of the conversations that I like to be a part of is how do we recognize this work and demonstrate how it's indispensable for making the community better for everyone, but in particular newcomers, and how do we acknowledge and support the work of LIPs or provincial umbrella groups in their indirect service delivery capacity. Next slide. And so that's important not only to support what you see here, an example of a settlement service provider organization. This one's called Regional Connections in Manitoba, to help such organizations do the daily grinding work of helping newcomers find houses and satisfying employment and navigate the school system, public transportation system and so forth, but also crucially connect these specific newcomer serving organizations with all of those bodies in the community that have a wider public mandate, but don't serve newcomers alone, right? So how do you do the facilitative work to connect newcomer serving organizations with non-specifically newcomer serving organizations that nonetheless are charged with the task of assisting newcomers with their lives in the community? So like the public health system, for example, or school systems that have a very large public mandate. Newcomers are part of that. How do you make all of those services in those big entities to be more receptive to newcomers for the benefit of everyone? Next slide, please. And then the sort of fourth element to the formula, as I see it, the Canadian government speaks sometimes about this whole of society approach. And I think this is a really noble effort. It's to, we see a tremendous amount of xenophobia across the world these days, and we see governments that maybe engage in such rhetoric themselves. I think a government challenging its citizens to be more welcoming to newcomers is one of the better positions you can see. That whole of society approach, it really recognizes that there are government responsibilities for making life for newcomers and for communities as a whole better, but it's really a task that needs to involve all of us as a broad public commitment in some way, shape, or form. My concern with the whole of society approach is always ensuring that there are adequate government resources to support the people that are trying to do this engagement, do the direct service delivery, make services and community life in general better for newcomers and really everyone in a given community. So it's taking that whole of society approach and adding a fairly robust public support of that approach to come up with the best possible community for all of us to live in. And if you want to ask yourself, what does this entail? Well, you see a picture here of a Ukrainian family that I'm thinking that this was specifically one that was settled in Manitoba. Ask yourself, what does it take to settle a single Ukrainian family in a larger center or in a smaller center, in Manitoba or in Ontario or elsewhere? And then you'll start to get a bit of an idea of the massive range of social actors that are enlisted to this task. So how do we better support that from a public funding perspective is one of the things that I try to think about. Next slide, please. And so really, that's what a lot of my research is involved with, is to think about how to support those that support newcomers and how to ensure that there are things like reliable funding for organizations to do the heavy lifting that's required to make a community more welcoming. And how do you connect those spheres that look specifically at newcomer issues and those that have a broader public mandate, like school systems, healthcare systems, and the like? And on the screen here, you just see a couple of illustrative examples of recent reports that we've published, one of which is on refugee youth with interrupted schooling in smaller communities in Manitoba, and the other is on settlement service providers themselves, particularly during the pandemic. And that one asks the question of, well, what did it take to do the day-to-day work to support newcomers during the pandemic? And when the pandemic is over, how do we continue to support service providers in their important work? So that's really all I'm going to chat about today. Thanks for listening, folks. You're welcome to contact me at any point if you want to chat further. That S somehow got capitalized when I put that in, but I think it'll get to me whether it's capital or lowercase. Thanks for listening today, folks.
That's great. Thanks very much, Ray. And we have a few minutes left for questions, which is great. And we have a couple from the audience. And I'm going to just start one and put Rana on the spot. If you wouldn't mind, Rana, just identify 2 or 3 of the key differences that you observe between smaller and larger communities.
So mainly, Professor Wynne, the transportation was the main key issue. The availability of transportation has helped many Syrian families during early settlement. Public transportation was available in these communities, and they shared that riding these city buses helped them to navigate the city. They appreciated the presence of public transportation, and especially women during early settlement, that they needed for their grocery shopping, following up with their medical appointments. It truly helped them. This is what was missing in these small communities. In addition, the other services, such as the interpretation, it was available, though it was a little bit costly, but it was available. Interpretation services, their services to their cultural food, the availability cultural food, the Arabic schools for their children, also the worship places. They didn't need to travel to different communities, such as in smaller communities. However, I found out that also all of these communities shared that affordable housing rate was shared by all participants in different size, small ones and big ones. It was issue for all of them, the affordable renting, housing rent, and also the employment barriers were shared by all women in different size communities.
That's great.
Yes.
Thanks very much for that. And perhaps we'll go to the 2 audience questions. And Mark, you might have something to offer on how you're addressing that. You may have some perspectives on that too, Ray. But let's get to the 2 audience questions. The first one is, do more people come to rural communities, I think, than other rural communities based on population density? So perhaps, Ray, I don't know if you have any insight into that from your observations, or perhaps Mark or Rana as well. But I think I'm reading that correctly. Do more people come to rural communities based on different population densities? So it really speaks, I suppose, to larger communities versus somewhat smaller communities.
Personally, I don't have really good contemporary statistics on that question, but I think it's a really fascinating one that has direct bearing on service delivery. So there are a lot of smaller communities in Manitoba, for example, that have a very large proportion of newcomers, and perhaps even greater than Winnipeg, but their funding for various services doesn't reflect that reality to have more newcomer accessible services or welcoming community type services. So I think it's often out of step. And I think often the presumption is that large urban centers they're the big multicultural populations. They're the ones with diverse populations and newcomers, and they become magnets for funding to offer services. Whereas smaller centers are saying, listen, we have it might not seem numerically very big to you, but as a percentage of our population, it's large, and we don't have the adequate resources to do right by that. So I can't answer that question directly, but that's what I think some of the service delivery implications are. And I think that's something that smaller centers struggle with, and it's not just newcomer related services, it's getting adequate funding for all services. It may look small to an urbanite, but it's a number that that needs to be adequately supported through funding and service delivery.
So thank you for that. The next question I'm going to call on Mark to respond to. The question is, how do people go about getting their educational credentials recognized? Is there any new legislation to make this process easier? And I'm suspecting you're dealing and working with people on a pretty regular basis around that question.
So we get this question quite frequently. It depends on their actual profession, but if you're in Huron and Perth, there is free services to assist with that, and that you can access them through the Centre for Employment and Learning, and so they will help you get your education transferred through World Education Services. So they assess what it would be equivalent to.
Would you say, Mark, are we doing better now than we were 5 years ago?
I can't answer that because I was not working in this sector 5 years ago.
It's an interesting question because I've observed this challenge throughout my career, people coming to this country and trying to have credentials recognized. And we all hear the story of someone driving a taxi with all kinds of credentials, but that's where they end up in. So.
I will say, like during COVID, we did see things speed up. So,
Okay.
Particularly with healthcare, people were getting their qualifications recognized faster than in the past, but I wouldn't say that's for every profession.
Would you say, Ran, if I might ask, I think there's some good news through your research for rural communities, because I think historically we would have had a stereotype that people coming to rural communities don't have access to the services. They have challenges getting employment. They have challenges perhaps being accepted. But I sense that through your research, there's some good insight into those questions.
Yes, Professor Wynn. So when I interviewed these families about their relationships with the locals, building with their neighbors, making friends, they highlighted how much they were welcome during early settlement. Maybe the private sponsors also added or boosted their presence, where they familiarized all the community about their presence, and they were able to build relations and they felt accepted. I felt, and even when I ask, sometimes in a few questions, I asked women about discrimination. So they shared that their discrimination maybe in big cities, not in small cities. They do not feel that they are different from the others during their early settlement. Yes.
Great. Thank you very much.
Yeah.
I'm sure we could go on with this conversation for some time, but I have a few closing comments to offer, so perhaps I'll go there. It begins with a big thanks to the three of you and the folks at Gateway as well for organizing today's session and promoting it and the like. But I just a few comments to review. As we conclude the lecture, we hope it's been educational and insightful, of course. Strong connection, I believe, between the future health of rural communities and creating a welcoming environment. I just think it's so fundamental to a civil society in terms of growth and development of that society. And I think it's really important that we help newcomers to feel comfortable and welcome, want to live, work, and with all of the time and energy of helping to feel comfortable, that they want to stay here for the long term. So I think it really is an important topic. And again, a big thanks to Rana, Mark, and Ray for your insight and your comments as well. Gateway would also like to thank their sponsors for their continued support. Without them, the lecture series would not be possible. And I'll list those sponsors. They include MicroAge Basics in Goderich, McGee Motors in Goderich, Libro Credit Union, Lighthouse Money Management in Goderich, McEwen and Fagan Insurance Brokers in Goderich. This really speaks to the community orientation of Gateway, doesn't it? The Huron Telecommunications Cooperative Limited, Huron-Tel, Zayres and Goderich, CIBC Wealth Management, and the Canadian Royal Bank, Canadian Royal Canadian Legion Branch 109. Also to mention, of course, opportunities for all of us. Gateway is a not-for-profit with charitable status, and Gateway greatly appreciates and welcomes any support they receive. Gateway is currently seeking sponsorship for the next series and season of lectures in September, including a live lecture series event. The sponsorship directly supports rural health and education and connects with members of your community and with every lecture. Contact Gateway if you're interested, and the email is info@gatewayruralhealth.ca, and you can find that on their website as well. Gateway also wishes to promote the upcoming, I think this is really cool, the upcoming Discovery Healthcare Camp. High school students attend a day camp from July 8th to 12th to learn about practical skills and pathways to healthcare. Register through the Gateway website now, limited number of spaces. So again, if you can't find that contact, reach out to me or anyone at Gateway and we'll help you get that connection. And just a promotion for the next lecture series. I'm going fast here because I have another 35 seconds, I think. The next lecture series will take place on Tuesday, June the 4th at 2024 from 12 to 1 p.m. Via Zoom with Dr. Al Lozone. And Al's just a fantastic guy. I'm sure you'll enjoy the presentation. He's a board member and research chair of the Rural Change and Development at Gateway. He will be speaking along, I assume, with a panel to From Aging to Eldering, exploring the development of the elder. So with that, again, big thanks to all of you for attending and big thanks to our participants today. And I wish everyone all the best. Thank you.